there. Okay. Vicky Hogarth, do you have any questions? Seeing none. There are only 4 comments online, Your Worship, and they're all just positive comments. One was from Jesse Hunt that says, I hear you guys are doing a great job. Keep up the hard work. I know my mom appreciates it and thanks everyone for the work. Michelle Henkel-Munt says, we are hoping to come and visit St. Andrews in July if all goes well. And this one's pretty much for you, Brad. It's from Gail Irwin, your cousin. They just want to say
Perfect.
That is all the questions from the public at this point.
Sounds good. Well, thank you guys for the feedback, and thank you for paying attention. I have talked to a number of people that normally I don't talk about town council stuff about. So Zoom is a platform as people are home that they really can follow along and find out what's happening on council. So now that we're through question period, we'll go to councillor and deputy mayor's comments. So council, I don't know if we'll go through formally, but does anyone wish to raise their hand and bring any comments forward? I see Councillor Harrison first.
Yeah, just one quick comment. You just kind of hinted at it, that when you look at on Facebook, both CHCO and the town's live streaming, between the two of them, probably have 40 people watching at times, which is a lot more than we ever get in person, which, I mean, we'd have to be doing something really bad to get that many people in person.
It's gotta be controversial.
Yeah, so it's certainly, as we go forward, when we start meeting in person again, possibly to get better at live streaming on social media to draw people in, because there's going to be an election hopefully in the next year, and we have to have some people interested to take our spots.
That's a very good comment, Councillor Harrison. There's no reason why we can't have some type of electronic device in front of us at a meeting so people at home can follow along. And the other thing is, if we are actually not able to make a meeting, we could still be engaged that way as well. So yeah, very, very good comments, Councillor Harrison. I appreciate them. Anyone else wish to make a comment? Councillor Grew.
Thank you, Mr. Deputy Mayor. I just wanted to make a comment and maybe a bit of an announcement with regards to the check-ins that are happening around town and the deliveries. The provincial government, as everybody knows, is starting to ease up on restrictions. To date, we have delivered, the town here has delivered, we're approaching 700 bins of groceries, 80 deliveries from the pharmacy. We've delivered that 700 bins amounts to over 2,000 bags of groceries. That's a lot of people that didn't go in the grocery store that we sort of helped out the workers there. We've had 62 volunteers working on this. With the provincial government easing restrictions, deliveries are being, we're starting to wrap things up. The last deliveries will be on the 15th of May. The check-ins are also being suspended. We're going to ease up on those as well. And we're going to cease the check-ins. We've been checking in on 60 vulnerable people. We're going to be ceasing those as of the 15th of May as well. But if anybody has any problems or encounters something unexpected, they can always call Town Hall at 529-5120, and we'll be glad to help them out.
Thank you very much, Councillor Grew. Everyone knows how important that program was, and all of those volunteers that have made that possible, including the Kiwanis in the town for organizing it as well. It's just, not a lot of communities had such a service. So we're very lucky to have that. And when this is, I'm sure you guys have a list of all the volunteers, but when this is all over and we can all gather, I look forward to getting together as a community and celebrating all those volunteers that offered that service. And you know, the fact that it's still in place to May 15th, it's greatly appreciated by a number of people in this community. So thank you for all that you've personally done as well, Councillor Grew, taking the lead on this.
Well, it's the volunteers that are at the center of all this. The other thing we're doing is we are maintaining the list of the vulnerable people. We are maintaining the organizational structure in place. We do have our list of volunteers. If we encounter a phase 2, we're ready to go at a moment's notice.
Okay, let's cross our fingers and hope that that's not required, but you know, it is expected that this is a long marathon and not a sprint. So it's glad to hear that the team's in place if we need them again. So again, thank you, appreciate it. Any other questions from or comments from council members?
May I say something, please?
Absolutely.
I think we're all aware that maybe we're lightening up on our restrictions and things like that. But I think we still have to be very aware that we don't want to let our guards down either, because they're saying that there's possibility of a second wave of this virus coming in the future. So I think we're going to have to be very aware of and be very careful, almost like a new way of living. So the point I'm trying to make is don't let your guard down, and be very cautious. Make sure you wear your mask. And I think that's going to be a requirement, as it was already said once here tonight. And as a senior, I found being able to go into the grocery store early in the morning when there's very few people in there, I found that really useful. I don't mind getting up at 7 o'clock and going to the grocery store. There's hardly anyone in there. It's wonderful. If that kept a few people from getting ill, I'd say more power to, I know you have to have your staff on hand early and things like that, but just little things like that, or big things, can make a difference. I'd also like to, again, reiterate and thank all the people who currently working in stores and shops and pharmacies and had to go to work. And a lot of people got to stay home, but the ones that had to go to work, they are our heroes, I believe. And thank you to all the staff, also the public works staff, the office staff. I really appreciate it. And I'm going to another subject right now. This is a little odd for me to say this, but here goes. I know that there's some folks in the town, like seniors, who aren't well and things like that, and they aren't able to rake the leaves out of their ditches and things. And I notice this as I walk around, which I do walk around quite a bit. Is there any thing that can be done to help this situation? Because leaves don't come out of the ditch by themselves. They actually have to have somebody rake them out of there. So that's just food for thought. Maybe there is an answer to it. Thank you very much.
Thank you, Councilor Bishop. I'll give town staff an opportunity just to respond to about the leaves in the ditch. So I'll pass over to the CAO, Mr. Spear.
Thank you, Your Worship. Well, I guess making sure I wasn't on mute. Traditionally, it has always been left up to the citizens to participate in that, because there is so many lines and so many leaves that come through the spring and the fall that come in there, that we probably have to hire an additional staff member to do that. Well, I appreciate that the seniors in town can't do it and the most vulnerable. There'd have to be a change in policy in how we would address this, because there's 800 or 900 properties in town that would have to be addressed all the time. And as you know, you can hit them once, twice, 3 or 4 times all through the fall as the leaves fall at different times. And so it's not an easy answer, but council would have to talk and debate whether they want to invest in additional staff to do that or not, or to come up with a policy that only serves certain members of the community who are most vulnerable to reacting to that.
Yeah. May I say something again then?
Absolutely.
I'm not really thinking of doing everybody's ditches. What I'm thinking of is people that just aren't able to do it. So perhaps there might be some people who have spare time and they would be willing to take on something like that, like a few, maybe a few residences or something. And it's called People Helping People. And we've seen great examples of this during this virus. And I guess basically it's pretty hard for the water to go down the ditches to get to the gutters if they're all clogged up with leaves. Bottom line. Thank you.
Can I say something?
Absolutely, Councillor Akachi.
Unfortunately, with this COVID virus, NBCC didn't have their volunteer day where they volunteer their students to do work such as that. They did a lot of things for the seniors, and because of this virus, they were unable to do it. So that's one of the things that was alleviated that Councillor Bishop was saying, because they would do those outside springtime activities for one day, and they did a lot of good for the town. So unfortunately, we're missing that due to the COVID virus. And I just want to say thanks to the staff and Public Works as well, because they do a great job. But we also don't want to overtax them. If it means hiring an extra person, then maybe that's what we have to do. But it is certainly a wonderful idea to do, or perhaps the Kiwanians might want to volunteer to do this for the people. Thank you.
It's a good point. I guess when it comes to Public Works, let's bring that forward during the budget discussion. I know that myself, I've been working on operational plans, and I know the CAO mentioned a number of things in which they have to sanitize, but like stuff like benches are supposed to be sanitized every day now. There's a number of different things, public doorknobs, like the list goes on and on outside of our normal cleaning contract. So we're really going to have to talk about how we keep this town sanitized this summer and meet the policies and places of all the buildings that the province has, because there is a number of them. And I don't know if it works the way for the town, but I know as a business, I have to have a COVID-19 operational plan, which will put extra staff on at Kingsbury to do cleaning. So I can only assume that we're going to have to consider that for the town of St. Andrews as well. So let's talk about the leaves, and let's talk about extra staffing for Public Works at that time, if I could make that recommendation. Seeing some head nods, so that's a good sign.
Thank you.
Thank you. And I think it's safe to say that we as individuals still have to persevere with our continuation of keeping COVID-19 out.
Sounds good. Any other questions by council or comments? Councillor Gumashel.
Just had 6 quick comments, Deputy Mayor. 5 thank yous. Just go through them really quickly. 5 thank yous and an invitation. So the first is thank you to staff for all their hard work during this difficult time. Secondly, thank you to Councillor Grew for heading up the successful home delivery program. Thirdly, thanks to council for supporting the work at the SJDA field to try to get it operational. Fourthly, thanks to all the frontline workers who are out there every day going to war with the virus. Fifthly, thank you to the CAO for his leadership in tackling the damage at the trestle from the major storm last month. And finally, an invitation. At our last meeting, Joanne Carney had some ideas about how to make the wharf more COVID friendly. So she suggested putting hand washing stations and things, and I found that intriguing. So if there are other people out in the community who have ideas about how we can make the wharf more inviting and COVID friendly, please send in your ideas to Mayor and Council. And that's all the comments from me. Thank you, Deputy Mayor.
Thank you. Very efficient in those different comments. I appreciate it.
The Zoom stuff is, you got to go quick.
Any other councillor comments? I think, Mr. Spear, there was something you want to add. Is that correct?
Thank you, Your Worship. Just briefly, I hate to tell council, but after a month of not having too many meetings, we are going to be meeting every week for the rest of this month. So next week on May the 11th, we'll be meeting on the budget. And so we're not going to be voting on anything specifically, but we'll be talking, discussing, I guess, doing formal votes on how to move forward. On the 19th, it's going to be full presentation by the Service Commission on how to move forward with the municipal plan process and everything there. For the public, we'll be doing it by Zoom. You're free to participate, but it's not going to be like a meeting with objections or anything like that. It's just to try to establish how council wants to move forward in the process and some of the things that have to be tackled. There'll still be additional meetings for the other plans in order to combine everyone. So for the public, don't worry, you'll still get a chance. But next week's meeting's more or less a strategy session now to move forward with the documentation. And again, that's on Tuesday after the long weekend, so the 19th. And then, believe it or not, we'll be back into a committee meeting in 3 weeks on the 26th for the June meeting. So that's coming up on us fast. So for anyone who's interested, just keep tuned in on the Tuesday, Monday, and the business of council continues.
Thank you very much, Mr. Spear. Really appreciate the update on meetings, and that kind of leads me to a comment that I just wanted to acknowledge all the members of council as well. You know, our 4 years is up. It's May, and the fact that you guys are continuing to be here for this community and do all this reading and all these meetings, it's greatly appreciated, because if we didn't have quorum, we actually as a community lose the power and it switches to Fredericton. So the fact that we're still able to have local representation because of all of your dedication is greatly appreciated, because it is May. It's the end of our time, and you're in overtime now, and it's greatly appreciated for all your dedication. And then my only other one before we wrap this up is just a happy belated birthday to Vicky Hogarth. I know she's on. She just celebrated a birthday, a little different with the COVID-19, but appreciate everything that her and Patrick do, helping us get the word of council out there. At this point, I don't think we have to go to closed session for anything, so I'll look for a motion to adjourn.
I'll move.
Deputy Mayor, may I say one thing before we leave?
Yes.
I'd just like to say thank you to all the people who work in senior citizens' homes and hospitals. They have, in New Brunswick, we haven't had such a hard time as we could have had, but in other nearby provinces, we're having quite a difficult time. So I just like to thank those individuals who have to go to work every day and put their themselves in harm's way. That's all I'm going to say about that. We really appreciate those people.
Thank you, Councillor Bishop. But this is safe to do, so I look forward to the whole community getting together and celebrating the volunteers and the essential workers. So there will be a time when we can acknowledge us as a community, and we're going to be sure to do that. But good job on council of recognizing all these people that are making our community run right now. So I did have a motion to adjourn from Councillor Akaji. Could I please have a seconder?
Also move.
Councillor Gumashel had his hand up first that time.
Okay.
So we'll give it to Councillor Gumashel. So with that being said, we are adjourned. Thank you everyone for tuning in.
Hello, I'm Vicky Hogarth, and this is a Newsbreak 26 special report. New Brunswick's response to the COVID-19 outbreak has been effective at curbing the spread of the virus and flattening the curve. Joining me today from the provincial offices in Fredericton is Chief Medical Officer Dr. Jennifer Russell to discuss the latest developments in the province. Thank you for joining me today, Dr. Russell.
Thank you, Vicky.
New Brunswick has flattened the curve, but you've said we should expect to see more cases. Where would these cases likely come from?
Well, because there's no community transmission at the moment, the only place they can come from really are imported cases, travel-related cases from outside the province or outside the country.
As we reopen the province, does that change the strategy for testing?
Not really. Our strategy for testing, we have to keep a minimum number of tests going on for symptomatic people to be able to find cases. Obviously we want people to call 811 and if they have any of the two symptoms on the list, that they should get tested, with the exception that children who have the purple toes or purple fingers, that symptom in and of itself, they can get tested just with that symptom alone. So travel, the fact that we're opening things up doesn't necessarily change the testing, other than we have to maintain the level that we have always done. And in fact, if we can increase that, that would be great as well.
Have you considered the idea of population sampling testing or testing asymptomatic individuals to look for spread in places that we're not looking right now?
Well, we have that conversation on and off at the national level to look at what is the benefit of doing that. So we actually are going to do some asymptomatic testing. So right now we are going to be doing asymptomatic testing for pre-op patients. But when we talk to other jurisdictions across the country who have done asymptomatic testing, the return on investment is quite low. In fact, Alberta did about 8,000 pre-op tests in asymptomatic people, and every single one of them came back negative. So you have to look for the cases where you think you're going to find them, and the biggest bang for the buck is really symptomatic people. So we did have some sentinel testing that was being done in hospitals and emergency departments. Those all came back negative as well, and those would have been symptomatic people, but they were in for different reasons other than, you know, being worked up for COVID. So in our strategy moving forward, we will continue with the pre-op testing for the time being and keep reassessing. And then we will probably be adopting what PEI has adopted, in that they are testing asymptomatic long-haul truckers.
Do you think there's a possibility that many New Brunswickers had COVID-19 before testing was widely available? There's a lot of thought in different communities that possibly people did have it earlier, before we were even very aware of it.
Yeah, I don't doubt that that occurred. I think there's a high likelihood that a few people had been infected without having met the criteria for being tested at that point.
Can you speak a little bit about herd immunity? What does that mean?
Well, herd immunity is when a certain amount of the population has had the infection and has recovered from it. And it does imply that there's a protective component of that when there's a high enough percentage of the population who has had the infection and recovered from it, or has been vaccinated against it. The problem with COVID-19 is that we actually don't know how long the immunity lasts. There are discussions at the national level around getting serological testing available at some point to test for antibodies, which would show if you were immune or not. The problem is we just don't know how long that immunity would last for. Does it last for 3 months? Does it last for 6 months? Does it last for 2 years? Does it last a lifetime? We actually don't know. So we will have to be doing some studies around that at the global level in terms of what that looks like moving forward. There is a question about reinfection or a relapse in somebody who has had it already, and these questions are still not completely answerable at this point in time. And so even if somebody does have a serological test available at some point in time and they do show an immunity, we can't say how long that immunity would last for.
But immunity testing could be something that we're able to test for at some point in the future in the province?
Yeah, exactly. It would be something, but again, you'd have to understand what is the purpose behind it.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province this afternoon are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Blaine Higgs, le Premier ministre du Nouveau-Brunswick. Dr. Russell.
Bon après-midi tout le monde. Good afternoon, everyone. Today there is a new confirmed case of COVID-19 in New Brunswick, and this new case is an individual between the ages of 50 and 59 residing in Zone 5, which is the Campbellton region. So there are now 3 active cases in New Brunswick, all confirmed within the last week, and they're all located in Zone 5, which includes the Campbellton, Dalhousie, and communities between Saint-Jean-Baptiste and Belledune. Nous avons aujourd'hui un nouveau cas confirmé de COVID-19 au Nouveau-Brunswick. Il s'agit d'une personne âgée de 50 à 59 ans qui habite dans la zone 5, la région de Campbellton. Il y a maintenant 3 cas actifs au Nouveau-Brunswick, tout confirmés au cours des 6 derniers jours et tous situés dans la zone 5. Our investigation has determined that these cases are a single cluster, all related to travel. The person who traveled did not self-isolate upon return to New Brunswick. And our public health team is working tirelessly to trace contacts, and in this particular case, there probably will be many contacts to trace. And just on that note, I know that with us having just returned to the yellow phase, to moving forward to the yellow phase, that we have all been really excited about getting together with close family and friends. But based on the information that I'm going to be giving you today, we may really want to rethink how many close contacts we do have on a day-to-day basis moving forward throughout this entire pandemic, no matter what color of measures and restrictions that we're in. Notre enquête a permis de déterminer que ces cas constituent un seul et même groupe, tout lié à un voyage en dehors du province. Notre équipe de santé publique travaille sans relâche pour retrouver les contacts, mais je suis préoccupée par le fait qu'il y a déjà eu des contacts importants avec ces personnes et que d'autres cas apparaîtront dans les jours à venir. Dans la région de Hamilton, mais peut-être autour du Nouveau-Brunswick, because as you know, the incubation period is 14 days. So as we've just identified these 3 cases in the last week, we would expect to see contacts of those cases perhaps testing positive in the next 2 weeks. As one of the cases is a healthcare worker who works in the region, I am very concerned that there has already been significant contact with the community, and that is why we do feel there will be more cases emerging in the days to come. So given these events, I have recommended to the government that immediate action be taken to slow the spread of COVID-19 in this region. Compte tenu de ces événements, j'ai recommandé au gouvernement de prendre des mesures immédiates pour ralentir la propagation de la COVID-19 dans cette région. À compter de maintenant, la zone 5 reviendra au niveau orange et les restrictions levées la semaine dernière seront réimposées pour cette région jusqu'à nouvel ordre. Effective immediately, Zone 5 will move back to the orange level, and the restrictions lifted last week will be reimposed in that region until further notice. This means that residents of the Hamilton-Dalhousie region should avoid close contact outside their 2-household bubble, and non-regulated health professionals and personal service businesses that opened of last Friday will again have to be closed. New Brunswickers who have traveled to the Hamilton-Dalhousie area in the past week or have been in close contact with a person who has traveled to that region during this time should monitor their health and seek testing if symptoms emerge. If you have recently traveled to this region, you can seek testing even if you do not have symptoms at this time. Avoid unnecessary travel to and from the Hamilton region. A testing facility will be set up in the Hamilton region, and residents can access testing with or without symptoms. Residents of Zone 5 should stay at home as much as possible and should monitor themselves and their families for symptoms of COVID-19. If you or any member of your family shows symptoms, you must immediately contact Telecare 811 or your primary health care provider and arrange for testing. We cannot afford to take chances with this virus. It is absolutely imperative that people get tested when symptoms emerge. That we have new cases of COVID-19 should not surprise anyone. We know this disease is still present and active in most of our neighboring jurisdictions. This is a global pandemic, and it's not going to end anytime soon until we have a vaccine. What matters now is how we deal with these cases when they emerge, but it also matters how each individual New Brunswicker behaves in the next, again, until there is a vaccine. We must very, very, very much so continue to follow the direction of public health in terms of hand washing, wearing masks when you cannot socially distance, and really and truly, because we never know when cases can pop up, really limit your close contacts. Even with the bubble concept, you must really limit your close contacts. New Brunswick's experience of the COVID-19 pandemic has been less severe than most other provinces in neighboring U.S. states. But we always knew this could change at any time with a type of event that we're seeing right now in the Hamilton region, where we are expecting to have to trace many contacts. This is in large measure due to the actions that government has taken to control the flow of people in and out of our province. The border restrictions remain in place, and for a good reason. This virus does not move by itself. When people with the virus move, they take the virus with them and can spread it to those they come into close contact with. That is why it is so important to really limit your number of close contacts. Maintaining the integrity of our borders is crucial in keeping the pandemic under control. We have been able to relax many restrictions on movement inside the province because of the efforts we have made to limit people coming into New Brunswick. We have and will continue to have people entering and leaving the province. Truckers can deliver food and other needed goods, and non-residents can drive through on their way to other provinces. New Brunswickers who travel outside the province are required to self-isolate for 14 days upon their return. We do know that people can spread the virus even if they don't have symptoms, and that is why we still must remain vigilant. The ban on non-essential travel under the state of emergency remains in effect and must be respected. Unfortunately, not everyone is taking this seriously. We have anecdotal reports of people crossing the border and reporting their lawful intent, only to learn that they were later seen in other locations, or if they were told to self-isolate or they were aware of needing to self-isolate, that they actually were not self-isolating. It is very important that people be truthful with public safety staff, with police, etc. Everybody needs to know what the situation is. They need to know this information so that everyone's health can be protected. Malheureusement, tout le monde ne prend pas cela au sérieux. Nous avons eu des rapports anecdotiques de personnes traversant notre frontière et signalant leur intention légitime pour apprendre ensuite qu'elles ont été vues dans d'autres endroits. Il est important que les gens soient honnêtes avec le personnel de la sécurité publique à nos frontières. Ils s'efforcent de protéger la santé et la sécurité de chacun. In moving to the yellow phase of our recovery last week, we have all put our trust in one another. And I'm just going to emphasize that again. We have all put our trust in one another. Each individual New Brunswicker is trusting that their fellow citizens are doing the right thing and making good choices. Over the past weekend, there were many joyful reunions of family and friends that warm our hearts. I was one of those people. I got to go to Bathurst and visit my parents, who I have not seen for a very long time, and gave them both a big, big hug. But just because we can do those things, it doesn't mean that we should get together in close contact with vulnerable groups or anyone. So elderly people, people who have comorbid conditions, any kind of chronic medical illness, no matter what age, people who are healthcare workers, people who have children in daycares, people who have friends and relatives who may work in a nursing home setting. We need to keep essential workers safe. So we have to make very, very good choices to protect the entire population and the economy. We want to keep moving forward, but doing so depends on you. For 2 months, New Brunswickers have shown exemplary common sense and good judgment. You have taken to heart the advice that will keep us all safe, to maintain 2 meters of physical distance. 2 meters of physical distance. This is what we need to all do to protect ourselves. To avoid touching your face, to wash your hands regularly, disinfect surfaces. I am encouraged to see many businesses reopening and embracing the new normal. I am pleased by how many New Brunswickers have taken to wearing community face masks when it is necessary to do so. These actions are protecting our healthcare system and the brave people who work in it. They are protecting those most vulnerable to the effects of this disease, and these actions are saving lives. Everyone has a role to play in slowing the pace of the COVID-19 pandemic and to prevent it from taking a stronger hold in our province. We must continue to work together to make this happen. Tout le monde a un rôle à jouer pour ralentir le rythme de la pandémie de COVID-19 et empêcher qu'elle ne s'installe plus solidement dans notre province. Nous devons continuer de travailler ensemble pour y parvenir. Et je suis certaine que tout le monde, le fin de semaine dernière, qui a réuni avec des amis et les proches, ont vraiment eu tellement de plaisir et de joie. Mais pour protéger chaque citoyen, il faut vraiment limiter le contact étroit, porter les masques, laver les mains, laver les surfaces et ne pas toucher la face. In closing, it is imperative that all New Brunswickers follow the directions of public health. It is imperative for us to be able to communicate clearly and regularly with the public to make sure that everybody understands the risks. We want you to have access to that information on a regular basis, so we do encourage you to follow us on Facebook, follow us on Twitter, and share our messages widely. This is truly, truly important, and it is a collective effort for us to all stay safe. Thank you very much. Merci.
Good afternoon. Bonjour. As Dr. Russell shared, we have confirmed a third active case of COVID-19 in the Campbellton region. Public Health has been actively investigating these cases to determine the risks to the community. La santé publique a déterminé que la cas d'aujourd'hui est lié à un voyage et qu'il est lié à 2 autres cas actifs dans la région. The travel-related case was a situation where a medical professional who traveled to Quebec for personal reason was not forthcoming about their reasons for travel upon returning to New Brunswick. and they did not self-isolate as a result. I want to be clear. There are still rules in place, and these rules must be followed. If you ignore the rules, you put your family, your friends, and your fellow New Brunswickers at risk. Today's case is evidence of that. This is a healthcare worker who saw multiple patients over a 2-week period following their return to New Brunswick. We are still contract tracing, but we know this zone is currently at a higher risk due to the actions of one irresponsible individual. We've been concerned about this happening in our province. We've been concerned, and up to this point, we've been so impressed with the diligence that has been exercised by New Brunswickers to help save each other. And as Dr. Russell has repeated over and over again, it's incumbent upon each one of us to do our part. It's not about trying to find a way around the rules. It's about finding a way to protect individuals, protect yourself. We know that we'll see more cases connected to this. That is why, to ensure the safety of everyone, effective immediately, Zone 5 is returning to the orange level under the province's COVID-19 recovery plan. The following rules will apply to Zone 5, the Campbellton region. A 2-household bubble is permitted. Your household can join up to with one other household, if both households mutually agree. You must not have close contact with anyone else. You cannot join up with more than one household or bubble. Non-regulated health professionals and businesses such as acupuncturists and naturopaths cannot operate at this time. Personal services businesses such as barbers, hairstylists, spas, estheticians, manicurists, pedicurists, and tattoo artists cannot operate at this time in this region. As well, public health is establishing mobile testing in the affected communities that will start tomorrow morning. This testing has to be done throughout the region. We have to control this within the region and ensure that it does not spread throughout our province. We've moved forward in a very productive way to see our province returning back to the new normal under the COVID concerns. But we can't let one region slow us down, but this region for now has to take a step back because it's important that we understand clearly to what extent the virus has spread. I strongly encourage people living in the Campbellton to Belledune zone to stay at home and to stay within that zone as much as possible to allow public health to get a handle on the situation. We knew that there would be more cases, and we also anticipated they would likely come from travel. We have been fortunate in New Brunswick that we have done a good job in limiting the spread of COVID-19 up until now, enabling us to go to the yellow phase of recovery. We got to this point by following the rules, and people must continue to do so. L'auto-isolement n'est pas une suggestion. Si vous avez voyage à l'extérieur du Nouveau-Brunswick, vous devez vous auto-isoler pendant 14 jours dès votre retour à la maison. If you have symptoms of COVID-19, you must get tested. We knew that reopening our province would increase our risk. However, this situation could have happened without reopening, and that's what is most concerning. This is why we must continue to do everything in our power to minimize the risk and protect the health and safety of all New Brunswickers. Our border protections are an important element of limiting the spread of COVID-19 within our province. New Brunswick has chosen to keep its borders controlled at this time. This is further evidence of the need to continue to do that. A few weeks ago in the region, there was a demonstration of over 400 people who were not demonstrating the practice of social distancing. Now we're seeing cases that could have expanded as a result of that event. So we cannot be complacent. We cannot think we're out of the woods here. In fact, we're very much back into the woods at this point within this region. All unnecessary travel into New Brunswick is prohibited, and peace officers are authorized to turn visitors away when they attempt to enter. It is recognized that some travel is necessary. Les déplacements essentiels incluent les résidents d'autres provinces qui doivent entrer au Nouveau-Brunswick pour travailler ou recevoir un traitement médical, et les conducteurs de véhicules commerciaux qui livrent des marchandises. Lorsque des résidents d'autres provinces entrent du Nouveau-Brunswick, on leur demande d'expliquer la raison de leur déplacement. If travel is deemed essential, Those residents are permitted to enter New Brunswick for that purpose only and are expected to return to their home province upon completing that essential task. Quebec, Nova Scotia, and Maine all have active cases of COVID-19. And now we have one more. Now we have 3 in total. Now is not the time for New Brunswick to take unnecessary risks, undoing all of the hard work it has taken to get us to this point. We have all played an important role to keep our province safe. And everyone that lives here needs to be part of that continuing effort to keep ourselves safe. This has not changed, and we cannot change as we work to reopen our province. Alors que nous présentons à la réouverture de notre province, il est plus important que jamais de travailler ensemble pour minimiser les risques. If you are in a situation where physical distancing is not possible, wear a community face mask. You should always have a mask with you so that you don't put yourself in harm's way and someone else doesn't put you in harm's way. This includes when you go to a grocery store, pharmacies, communal areas in the office. Anywhere close contact with others is inevitable. Wear a community face mask. This is not a suggestion. This is part of the emergency order and is for the safety of all of us. These are simple steps that we all must take to protect ourselves, our loved ones, and our fellow New Brunswickers. Up to this point, we have done a good job. We've done a great job in containing the spread of COVID-19 in our province. But we've always been concerned that there could be a day when it could change dramatically. And there could be what has been referred to in some ways as a situation that has multiple contact points. And that is the risk that we're seeing right here. We know the virus is out there. We know it'll continue to be out there until we have a vaccine. This is not a time to let your guard down. This is a time to put our guards up. This is a time to do our part and continue doing our part, even though the challenge to do otherwise is in front of us every day. So let's stay focused. Let's not lose what we've gained so far. Let's continue to allow our province to rebound. Let's get this case sorted out. Let's understand how many multiple cases there may be around it. And let's once again get our province back on the track of a full recovery. Thank you. Merci.
Thank you, Premier. Thank you, Doctor. Merci, Monsieur le Premier ministre et Dr. Russell. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Elizabeth Fraser, CBC.
Hi there, my question is for Dr. Russell. You have identified the latest case of COVID-19 involves a healthcare worker. Can you tell us what kind of place this person worked in and how many people they would have treated or come into contact with over the past week?
Well, our contact tracers at Public Health are doing all of that work right now, and so at this moment in time, all of the people that the person came into contact with, we have the lists of those names, and so they're being contacted right now. I don't have the exact numbers. I can tell you that they have worked in the Campbellton Hospital, so that's the one facility that I can tell you right now that they have worked at. And as we have more information, we'll be sharing that, and if there are any public exposures whereby they can't trace the contacts, then I'll be letting you know that as well.
Thank you, Doctor. Ms. Fraser, do you have a quick follow-up?
Yes, another question for Dr. Russell. Was this healthcare worker told at the border to self-isolate? Did the Department of Health follow up on this order, and will the healthcare worker be charged at all?
Again, this situation we are currently investigating, so I can't share any details of that right now. All I can say is, again, all the things that we need to do from a public health perspective are being worked on, and whatever other details around that, I can't share any with you right now.
Thank you, Ms. Fraser. Thank you, Doctor. David Caron, l'Acadie Nouvelle. David? Caron.
Oui, bonjour, m'entendez-vous?
Toujours.
Oui, bonjour, ça va bien? Oui, ma question s'adresse à la personne qui voudrait la répondre. Je me demande simplement, parce que là, Campbellton, en raison de 3 cas actifs, retourne dans la zone orange. Combien de cas est-ce que ça prendrait dans d'autres régions pour que par exemple, la péninsule acadienne, pour que ça recule à orange? Est-ce qu'on parle d'un seul cas pour que ça retourne ou ça en prendrait plus? C'est quoi un peu le processus? Merci.
Alors, premièrement, je vais parler un peu pour quelles raisons qu'on retourne à orange dans la région de Campbellton. Je vais commencer avec ça. D'habitude, 3 cas comme ça qui sont reliés au voyage, ça ne nous inquiéterait pas. On n'irait pas à l'orange. Cette situation est unique parce qu'on a plusieurs contacts étroits. Et alors, pour faire le travail, pour les contacter, pour les faire tester, c'est vraiment important à ce moment-ci qu'on retourne à l'orange pour protéger les gens de cette région-là. Alors, pour chaque situation, c'est comme ça qu'on va évaluer. C'est quoi le risque à ce moment-ci? Alors, nous avons déjà dit que le risque pour aller à rouge, à n'importe quel temps, ça serait des cas qui ne sont pas reliés. Ça veut dire c'est la transmission dans la communauté qu'on ne peut pas lier au voyage. Alors, si on verra quelque chose comme ça, 3 cas dans 6 jours qui ne sont pas reliés, puis c'est la transmission communautaire qui ne s'est pas liée au voyage, dans ce cas-là, c'est dans ce temps-là qu'on pourrait dire que ça serait quelque chose de plus sévère. Mais à ce moment-ci, même si on voit d'autres cas dans d'autres régions, l'implication à ce moment-ci, c'est que c'est peut-être qu'on va être relié à les cas comme tel aux régions de Campbellton. Mais au fur et à mesure qu'on a plus d'informations, on va le relier aux médias. Mais à ce moment-ci, le risque, c'est vraiment dans la région de Campbellton parce que les contacts étroits qui devraient être contactés sont présentement, plusieurs sont à la région de Campbellton.
Merci, docteur. Monsieur Caron, as-tu un suivi?
Non, merci. Je passe le flambeau.
Merci, Monsieur Caron. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My first question is for the Premier. Premier Higgs, is the individual who did not self-isolate facing any penalties for reckless behavior?
So somebody already asked a question like that, Vicky, and at this moment in time, the investigation in all of the areas of these cases is underway. And so at this moment in time, all we can say is the investigations are ongoing, and whatever information we can share with you in the future, we will. But at this moment in time, all we can share with you is that we have 3 cases. We're tracing all the contacts and looking into all the details of the situation.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up this afternoon?
Yes, thanks, Bruce. It's also for Dr. Russell. Dr. Russell, how is the person over the age of 90 who tested positive doing right now, and what is his or her relation to the travel-related case?
So in terms of confidentiality, I can just say they are linked, so they can all be traced back to travel, to that one case who traveled. And I can tell you the last time I spoke with my public health team, that individual was doing well.
Thank you.
Thank you, Doctor. Thank you, Ms. Hogarth. Kevin Bissett, Canadian Press.
Yes, good afternoon.
Hello.
Hello, it's gone to music. I can't...
Take the question anyway.
Kevin, just shout out your question.
All right, okay. Dr. Russell, when did the healthcare worker travel? And do you know, in doing your contract tracing, whether that person was part of the gathering on the bridge last week?
Again, these cases are still all under investigation, so all the details around these cases are being investigated by public health right now, and I don't have any more details to share with you other than the contacts are being traced at the moment.
Kevin, do you have a follow-up?
I do. I wasn't able to hear the answer, but I'll have to listen on the tape. And the other question is what will it take to expand the restrictions beyond Zone 5? So in other words, if you start seeing other cases beyond Zone 5, what kind of things will it take to expand what you've done now and going to the orange level in Zone 5?
Well, I guess right now we know obviously the incubation period is 14 days. So the picture that will be painted over the next 14 days will really give us a clearer understanding of what's happening. We expect that most of the contacts traced will be in the Campbellton region. And so that's the focus right now. But we know that there could be people who have traveled to that area or have been in contact with people who travel to that area that are outside the Campbellton area. So it is possible that we could see some cases related to these 3 cases that are outside that zone. But we will assess it as time goes on. And again, in these particular cases, there are a large number of contacts that we expect to be tracing, and it'll take us a while to see that. But again, within the first 14-day incubation period, that's when the most information will be revealed to us in terms of the data.
Thank you. Hang on, everyone. What am I saying?
Somebody's got to mute their phone, their radio, or their TV, or
Somebody who's on the line must mute their phone or mute their phone because we're getting the music. You want me to get everybody to recall in? Or just let it go with the music? Adil Ibrahim, CBC. Okay. Everybody, please call back in. We're disconnecting right away. Merci.
And Dr. Russell, 3 weeks ago you said you were having meetings to clarify border rules and make sure borders aren't so porous. What have you decided and changed as a result of those meetings, specifically to clarify enforcement rules to border officers?
So we've had some of those discussions prior to today and the situation as it's unfolding, and those decisions were more around compassionate exemptions and how the Red Cross is involved with some of that work right now. As a result of this situation, we're definitely going to look at the border measures and what measures are in place currently, if there are any changes that have to take place. But certainly the message around people self-isolating when they come across the border, it is very, very important. When you're supposed to self-isolate coming across the border, you really need to self-isolate.
Thank you, Doctor. Ms. Ibrahim, do you have a follow-up?
Yes. News that someone over 90 in Campbellton has COVID-19 raised a lot of concern, so much so that the nursing home posted a message on Facebook that it's COVID-free to reassure the community. So when you announced the case, why did you not say right off the bat that the person is not in a care home to avoid this kind of confusion and upset?
Well, the sad part of the situation is that we haven't finished the contact tracing yet, And when we finish the contact tracing, we don't know at this point if there have been healthcare workers that could have come into contact with this particular healthcare worker who doesn't work in a nursing home. So I can't guarantee that right now. So that's why we have to be very cautious about what information we share at the moment in terms of reassuring or not reassuring. So everyone has to be vigilant. This is going to continue to happen in the months to come until we get a vaccine. So the only thing we can guarantee is that there are no guarantees. And all we can do is make the best decisions based on the information at hand, knowing that there will always be risks and that the information that we have around what each individual New Brunswicker has to do to stay safe, we have to trust that people will use good judgment and take the precautions necessary to protect themselves and their fellow New Brunswickers.
Thank you, Doctor. Thank you, Ms. Ibrahim. Adam Harris, Telegraph Journal.
Thanks, Bruce. I had a question on I guess, travel in and out of the Campbellton region. Quebec set up road checks within their own province in northern Quebec to stop people from going to and from areas like Montreal with more cases. Is that being considered here, road checks within the province?
Yes, Adam, it is being considered. You know, it's very difficult to do, and I know that Quebec did set that up. And we are actually looking into how effective it was, and many of their cases were confined to the Montreal area. I think what it's, when it becomes more of a concern is that in this situation, we're not able to open the, you know, like we've opened the province up in its entirety in different sections, but the province came up together. This is a situation where we're in this zone 5, we're actually, you know, changing and moving back one phase. And so it's a unique situation for us right now. But I guess the concern, I want to use a clear example in the case of, you know, hairdressers as an example. So if they're closed in zone 5, the concern is that someone would say, well, I'll just move down, I'll go down to zone 6 and go to another zone rather and get my hair done. You know, the concern is we want to confine this to this region at this time. So all movement in and out of this zone should be limited to essential only. And we need everyone to do their own part, whether it's going or coming. Not trying to skirt the rules, but just saying, you know, for the next couple weeks for sure, we can just stay at home, we can isolate in our community, we can follow the rules of public distancing, we can wear face masks, we can do the things that are appropriate to ensure that there isn't any further spread in this particular zone and any further spread within the province. So we are relying heavily, more so than ever, on the citizens of the province to really pay attention and not try to skirt the rules, but really let's keep this confined, let's let public health do their work, and let's over the next couple of weeks get a real handle on this.
Thank you, Premier. Mr. Hirsch, do you have a quick follow-up?
Yes, please. For Dr. Russell, you mentioned the compassionate care clause in the state of emergency order. Can you take us through the process of how people would apply, and then also how you determine whether or not they meet whatever the bar is?
Well, there are going to be forms. I'm not sure if they're available online at this time, but my understanding is there are going to be forms online that you can fill out, and then the Red Cross is involved in helping make those decisions. But obviously, in light of the circumstances today, we're probably also going to be looking at that again. And just to follow up with what Premier Higgs said about what Premier Higgs was saying about the Campbellton region, because there's a 14-day incubation period, these 3 cases who just tested positive recently could have been contagious any time throughout that 14-day period prior to them testing positive. And if they transmit it to somebody who traveled outside of that zone or were in contact with people from outside that zone, that means that there are people across the province who could have been at risk and still are at risk. And so that's why I need everybody in the province to really be vigilant about physical distancing and limiting your close contacts. So again, we're very, very concerned about the Campbellton area right now, but we know that over the last 14 days, other people from outside that region could also have been affected.
Thank you, Doctor. Thank you, Mr. Hirsch. Jean-Philippe Hugues, Radio-Canada.
Oui, bonjour. Ma question est pour le ministre Blaine Higgs.
Selon des données qu'on a obtenues de l'Organisation des mesures d'urgence, il y a moins de 2% des personnes qui ont été refusées à la frontière du Nouveau-Brunswick. Est-ce que cette cible semble efficace finalement pour contenir les cas en provenance du Québec?
I didn't understand the question.
Peux-tu répéter?
No, I just didn't get it from the interpreter.
Vous voulez que je répète?
Oui, s'il vous plaît. Et plus fort.
D'accord. Selon des données qu'on a obtenues de l'Organisation des mesures d'urgence, il y a moins de 2% des personnes qui sont refusées à la frontière. Donc, est-ce que ça atteint les cibles que vous aviez en tête pour contenir la transmission de la maladie du Québec vers le Nouveau-Brunswick?
Well, I think it's difficult to say if it actually contains it or not. The point of understanding who's coming across the border would be simply to say, is this an essential service or requirement, or is it not? That's why we're very focused on that, because we know that the struggles that our neighboring province is having in certainly the Montreal region. So I don't know that we can put it in a percentage in terms of the numbers that have turned away, but we do need to understand clearly what the reason for coming into the province, what the reason for traveling back and forth across the border, and how do you mitigate any exposure because of that travel. And certainly coming into our province from outside, there's a 14-day requirement to self-isolate. And if it's essential service, you know where they're going, what they're doing, and they're going back for maybe a job requirement, and maybe it is the case of working in a hospital. But that's the purpose of the border crossing, is really to know what traffic is moving, what can you control through the measures you put in place in terms of what they're doing at the time they're in the province, and also what traffic can you turn around that just doesn't need to be traveling at this time.
Thank you, Premier. Monsieur Hugues, as-tu un suivi?
Oui, c'est un suivi pour Dr. Jennifer Russell. On a parlé de ce qui pourrait amener un passage à la phase orange dans les autres zones du Nouveau-Brunswick, mais dans la zone 5, qu'est-ce qui déclencherait un retour à la phase rouge, c'est-à-dire un confinement complet?
Ça va vraiment être déterminé par comment ça déroule pendant les prochaines 14 jours, parce que les cas on voit maintenant, les 3 cas qui ont été diagnostiqués jusqu'à date, voir combien de cas qui vont, le résultat de ces 3 cas-là, s'il y en a d'autres transmissions à d'autres personnes dans la région, on va voir au fur et à mesure que ça arrive, qu'est-ce que ça va donner. Alors, on ne va pas faire des décisions avant qu'on voit les prochaines couples de semaines, comment ça déroule.
Merci, Doctor. Merci, Monsieur Andrew Watt, Telegraph Journal.
Hi, my question is to either Dr. Russell or Premier Higgs. Is this situation going to affect the, changes to the yellow phase that you were forecasting last Friday?
All it was going to mean was really for the Campbellton region that they wouldn't be moving forward with their yellow, and they would be going back, because there were some 2 phases to the yellow. So all the things that were going to be introduced in that other phase of yellow, that won't be happening in the Campbellton region. So they're going back to orange at this point in time.
Doctor, thank you. Mr. Watt, do you have a follow-up?
I do. So there's been a lot of families that are waiting to, they got loved ones in nursing homes, they've got loved ones in hospitals that they can't go see. And, here we have the latest sort of case involving a healthcare worker, not telling the truth and going off and doing something they shouldn't have done. I mean, is it I'd just like to hear somebody comment on, the impact on these families and whether these rules are going to change anytime soon.
Well, certainly in Zone 5, things won't be moving forward in Zone 5. So for the rest of the province, as of right now, we did have a meeting with the task force this morning about what the next steps were going to be for visitation of family members in hospitals, nursing homes, etc. And as of right now, again, we have some more decisions to make based on the situation today. And if we have any announcements in terms of moving forward, then we'll be doing that in the next few days.
Thank you, Doctor. Thank you, Mr. Watt. Tom Bateman, Times and Transcript.
Good afternoon for the Premier. Does this announcement affect your resolve to reopen the province to groups like seasonal property owners, or perhaps the bubble province concept that we've talked a lot about in the context of PEI?
No, it doesn't. We need to move forward and get our province back on track economically. We need to get people back into functioning under the new COVID rules. But I think what it should enforce is a resolve that we have as a province and as citizens of the province to actually adhere to the public health rules. It does heighten the resolve to continue our diligence at borders, to get more clarity into who's traveling and why, to be more stringent when we're asking questions and getting and people giving us answers that we know for sure. We know that the region has had a lot of pressure on the border. We saw that in the rally a few weeks ago. A lot of interest to open the border just fully between those communities. I think this reinforces the very reason why we were resisting that, and that we must resist it. We've been working closely with public health on border controls because that has been our mainstay. So I think the resolve is that we just must heighten our awareness. We can't be complacent, and everyone should see this as a clear example of what we have been mourning collectively here with Dr. Russell and myself, that this could change overnight. And let's not have this be a moment when it actually goes in a direction that we don't like.
Thank you, Premier. Mr. Bateman, do you have a quick follow-up?
Yeah, I do. Again, for the Premier, we learned about a tentative agreement between the Council of the Nursing Home Unions and their employer today. How did the COVID-19 pandemic change or affect your government's understanding of the work done by the members of these unions?
Well, I think that, certainly we've been proud of all of our healthcare workers, our first-line workers, everyone who has really stepped up in this process and been working, endless hours to make a difference and keep our province safe. So this situation, in what we're seeing right now is unfortunate, but it doesn't change our recognition and our appreciation for all the work done to date. But it does give us clear indication of that work must continue. So I'm very pleased that, a tentative deal has been done, and it's left to the membership to vote. And I think the Minister of Social Development may be talking more about that later, or maybe already has. But the point is, we respect the work that's been done. We want to have that contract behind us, and I'm feeling that's certainly an accomplishment. That seems to be where we are at this point.
Thank you, Premier. Thank you, Mr. Bateman. Laura Brown, CTV.
Hi, Premier. I specifically want to ask you, I think I speak for a lot of people in the province when I say we need to have more details about this healthcare worker. Were they a doctor or a nurse? They obviously came into contact with a 90-year-old or someone in their 90s, and possibly someone as a child. I think that we definitely need to know more about this healthcare worker. And I guess, can you tell me what level of concern you have as we move forward with this particular investigation?
Well, again, I have a very high level of concern, both a concern to ensure that, to understand, was this a clear or what would appear to be apparent violation of our current rules? If indeed that is the case, we will move forward with understanding, and if charges need to be laid, they will. I think what it does say to us is that we're going to enforce the rules, but it's more importantly, we will never catch everybody, so we shouldn't expect that. I think it's too early to put all of the facts on the table because we don't have all the facts, but we will. Over the coming days, we will. And I know that it's going to be difficult, maybe as more information comes forward, as Dr. Russell said, to understand how widespread is this. And we may need to have a situation where you're actually asking the public, if you have any connection here, please show up and be tested. But that'll be determined by public health in the next day or so, because we are not going to let our guard down here in any way, shape, or form. In fact, we're going to be raising it. And the testing, we have ample testing capabilities. As Dr. Russell said, we can set up mobile units. We can process a lot of people. So I'm encouraging everybody in Zone 5 to get tested. When these mobile units set up, let's really get a handle on this before it ever gets out of control.
Thank you, Premier. Ms. Brown, a follow-up?
Yeah, I'm wondering if it is even possible. I understand that we have the testing supplies, but if this person was treating cases over the course of a week or 2 weeks, and then those people were going home to their families, obviously it's getting out of hand very, very quickly. And like you said, reopening almost has nothing to do with this. This could have happened anyway. How do you even go about the amount of work that this is going to take to trace everyone back?
Well, Dr. Russell may want to speak to that directly, but it is going to be a mountain of work. And you're absolutely right. This could have happened without reopening. But because it's happened, it means that we have to now restrict movement to avoid further spread. So we're caught now in a situation where it wasn't due to reopening, but because of reopening it, we have to back off a bit. It will be an extensive amount of work by public health to trace every interaction and to understand who has gone, how far has it spread. So it is going to be an intense few weeks because it is over a 2-week period that much of this is solved, but it could be beyond that. It's going to be really intense, but I believe our public health officials and our officials that we have out on the borders are up to the task. They've certainly shown it to date.
Thank you, Ms. Brown. Megan Yamoa, Global News.
Thank you. Dr. Jennifer Russell, can you please explain the heat alert response system's 3 levels and how New Brunswickers will be notified when a heat event is expected?
Hi, Megan. Yes, so New Brunswick has a heat alert system that's been in place for a while, and obviously we want to protect people from heat illness that would require them to become hospitalized and become very sick and even possibly die. So we want people to drink plenty of fluids. We want them to wear lightweight gear, you know, if you can avoid the sun, etc. And the heat alert advisories, I don't have all the information in front of me in terms of the levels. I think there's about 3 levels, and it's based on the temperature, but how long it stays above a certain temperature. So if we know that it's just going to go above a certain temperature for a day, then it would be, you know, the level 1. If it was going to go above a certain temperature but stay at that level for more time, and level 3 would be the highest level, and that would be the most dangerous. So each of those heat alert levels come with risks, and the public needs to be aware of that so that when we do provide that messaging on social media, and the municipalities are ready to assist with alerting residents as well. So it's a very, very good system, and it is to protect the public and also keeping your pets safe as well. So, and all of the advice around what to do in that time frame when those heat alerts are issued is really protect people, especially people who are elderly, especially people who have chronic medical conditions. Those people would be more severely affected, and when, again, we do see more hospital visits during that time if people don't take the proper care and follow the directions around staying cool and as much as possible and drinking lots of water, etc.
Ms. Yamoa, do you have a follow-up?
Nope, that's everything. Thank you.
Thank you. Voilà la fin de notre mise à jour. Merci beaucoup tout le monde. That concludes today's update. Thank you very much.